Welcome back to Just Facts with Dr. Juste. So a lot of my patients are asking, what options do we have to restore missing teeth? If you have a missing tooth, like in this case, one option to restore it is placing an implant. What we use is a titanium screw that goes into your bone, and we leave it alone for 4 to 6 months to heal. After healing it's done, we use something like that. It looks like another screw. That is called a titanium abutment. We place that in to the implant, and then that is used to be restored as a tooth. On that, we can place another crown. And there you have it. You have a restored tooth. Now, if you don't have enough bone to have implants placed, there's another option. You can replace missing teeth with a restoration called a bridge. A bridge restoration will require drilling down the adjacent teeth, like so. After that, we produce a restoration from porcelain or metal and porcelain fused together, something like that, where it's gonna go on like caps on adjacent teeth, and the middle tooth is called pontic. That is your fake tooth. So that's how you would restore missing teeth with a bridge. And your third option is obviously removable partial dentures, but those are way less comfortable than some fixed procedures. I hope that answers most of your questions. If you have any more comments, please comment below. Bye.